One of the things that's always scary for any patient, regardless of what they're getting treated at any doctor's office, is not knowing what to expect when they come into the clinic. We're very sensitive to that here at ECCO, and so really just want to provide an overview of what to expect from referral process to actual treatment day. So the way it usually works is we get a referral either from your doc or you call and you set up your consultation. And then you sit down with the doc, maybe via telephone, it may be via Zoom, it may be in person. And then we go over everything that you've been going through, all of your symptoms and the workup that you've had up to that point. We review all the surgical options that are offered by urology. And then we also discuss prostate artery embolization. So that way we can figure out what best suits the best thing for you. Once you've come to a conclusion about what sort of treatment you get, then we'll help you get to that point. If you opt to do prostate artery embolization, then our next point is to get insurance authorization. So that way you don't have to worry about that financial side. You'll have all of that information before you ever show up for treatment day. And we'll go over everything like the amount of your copay if you owe anything, or if you don't, you'll know that beforehand. So there's no surprises on the back end. When you actually show up on procedure day, you will be getting conscious sedation for the procedure. Conscious sedation is often called twilight. The way I like to explain it is, it's kind of like if you go to sleep and you sort of wake up and you have flashes of a dream that night and you kind of remember it, but not really. Sedation is that same way. So we don't put a tube down into your lungs to breathe for you. We don't use general anesthesia with propofol. So this is a little bit easier on you. It's certainly lower risk than general anesthesia, and you're very, very comfortable throughout the entirety of the procedure. So we do the procedure in what's called an angiography suite, which has a big piece of x-ray equipment, which is how we're able to see the blood vessels. And we go into the artery just using nothing but a small puncture. I typically do it through the wrist. So I'll go through an artery in the wrist. I'll do a needle stick using ultrasound guidance. And then we use x-ray to guide our wires and tubes through the arteries into the arteries feeding the prostate. Procedure takes about an hour and a half typically. The majority of that time is just creating the vascular maps and identifying the blood vessels so we know which ones to treat. Once those are treated, we use a small what's called a VASC band, which is just a pressure band over the puncture site in the wrist to stop or prevent any kind of bleeding once the procedure is done. You wear that during the recovery period, but you go home with nothing but a Band-Aid on. And this access point and that sort of band, it helps the patient recover quicker. Most patients are discharged within an hour or so of the procedure, and that usually just depends on the patient. We're not going to rush patients out of our office. If that takes an hour, hour and a half for you to wake up from the sedation, that's completely fine. But typically an hour is about the amount of time you would need for recovery after the procedure.